Good evening. I'm so sorry that I can't be with you tonight. Congratulations on your meeting. And I want to just say how much I appreciate all that you do at AseraCare for our senior citizens and others as well. Having been a nurse for the last 40 years, I do very much understand what you are dealing with in your industry. I appreciate the kind of care that you give, and we so much need the kind of care that you do give as we move forward with 10,000 baby boomers retiring every single day. Long-term care is going to become more and more important. As I say, I've been a nurse for over 40 years now, and what I have seen is that people are the most comfortable when we keep them in their home setting. It not only increases their quality of life, but it also saves our health care dollars. And so being a nurse that has been in the home health care business as well as provided some hospice care, I so much appreciate where you are and what you're doing. Now, we don't know what the future is going to bring with our health care dollars, and so you're providing this kind of care for a cost that is cost effective while having quality care is important. I want you to know that it is also important that your voice be heard. When you know a bill is going to come about, or you have some information that you need to give to your legislators to let them know about a new idea, your voice is so important. You need to make sure that you're keeping in contact with your legislator, both at the local level, the state level, and also at the federal level. Because these decisions are made many times by people, not like myself, who have a healthcare background, but are being made by people who have really no context for what you do. I want to encourage you to be involved with your advocacy for your patients. I can tell you it is so important that legislators hear from you directly, and that they hear your personal stories. They hear how you're taking care of someone has enriched their lives, that it has made a difference in someone's life. As I have already said, it's so important for us to have quality care and also at a cost that saves us healthcare dollars. So if you will let your legislator know about a subject matter that is either coming up or something that is very current and being discussed either at the state level or at the federal level, it makes such a difference because not everyone has a healthcare background as I do. So when you can make something more personal for them, they really can then understand what it is that you're trying to say and advocate for. You're the only real advocate that many of these patients will have. So write your personal stories. I know that the American Cancer Society uses a little saying of a hook, line, and sinker. And your hook is to let them know from a very personal level about what this has meant to someone. Give them a good line, something that someone has said back to you that you've cared for. And then the sinker will be asking for whatever the ask is. And if you can do that, where you put a hook, line, and a sinker out there, your advocacy will be so effective and so much more important for your patients. Thank you so much for what you do as caregivers. Caregivers deserve a special place in heaven. And I can never say enough thank you. Since I'm not doing that now, thank you for those who are. The care that you give from your heart and the sacrifices that you make for the people that you care for. So thank you for allowing me to be here with you tonight. May God bless you and God bless your service to your clients.